page number 464, chapter 21, food sensitivity. So food sensitivity, it's an immune response basically. Okay, your immunity is supposed to fight off infections, any foreign objects, any foreign invaders like bacteria, virus, fungi, parasites. Okay, your body's immune system is made for this specific action to fight infections. Okay, but when your body's immune system starts to see food as an invader, not all food, some specific kinds of food as an invader, and it starts to attack, or it starts to show immune responses or symptoms that you're hyperventilating or your immunity is hyperactive. That's when we call you may be suffering from food sensitivity. Okay, there are different types of food sensitivity, allergies, intolerance, etc. We'll dive into deeper aspects of it. So basically, you have two categories: food sensitivities or intolerance versus food allergies. Okay. So food sensitivity, it can happen in any age. It usually talks about your intolerance, like lactose intolerance, okay, fructose intolerance, some inborn metabolic disorders, okay, intolerances. It can start at any age, but usually it is seen in young children, okay, because see, when the child is weaned off from the mother's breast milk and slowly new foods are introduced, okay, the child may take up 1 to 2 years to get used to it, to get used to new foods. Okay, specific food will not give any reaction to the child, to the infant, but some food can give a reaction. But when the child grows into a schooler, preschooler, or sometimes even into adolescence, their body starts to adjust to the new food, and they can completely resolve their intolerance on their own as they grow up. Okay, so food intolerance or sensitivities, usually you can overcome that. Okay, when you grow up, usually your body can overcome food intolerances on its own. But that's not the same for allergy. Once you are allergic to something, it cannot change. Okay, you cannot change your allergies. You never grow out of your allergies. It's very rare. Okay, so food sensitivities can take place at any age. 45% of the population suffer from food sensitivity. There is also some studies that claim, okay, we are not sure about it, but they claim that when it comes to Indian population, okay, 60 to 70% of the Indian population, they are lactose intolerant. But dairy products, they are the majority of our diet, even though India has a huge number of vegetarian population. Okay, they are not vegans, they are vegetarians. They obviously involve, sometimes they are ovo lacto vegetarians. Okay, they have egg as well as milk, but they refrain from having meat or other animal products. Okay, so having said that, it is claimed that, we are not sure about the sources, we can't completely accept the sources as it is, but it is said that 60 to 70% of Indian population, okay, are naturally lactose intolerant. Okay, if we cut out dairy from a product, not dairy, uh, things, the dairy products which has lactose, okay, you do not have to cut out buttermilk or curd. Okay, curd and buttermilk, they do not have lactose, they have lactic acid instead. Okay, so if you cut out, or milk and all, okay, um, smoothies, milkshakes, etc., cheese, okay, these things, if you cut out, it will give you a much better health. That's what they say. Okay, so we are not sure about this data, but it is, studies claim that. Okay, delayed reaction to the food up to 72 hours. For example, if you have, let's say you are lactose intolerant, and if you had milk or some milk product for the first time in few weeks, not immediately or the same day, your body may not respond. Your body may take 2 days or 3 days maximum to respond to what you had 3 days before. Okay, so that is intolerance. But does allergy have the same pattern? Can you answer in the chat box? If you went out, you are allergic to dust or something, will your body show reactions 2 to 3 days after? What do you think? What is the difference between allergy and sensitivity then? Yeah, in case of allergy, immediately it is shown. Okay, allergies cannot be delayed. Okay, immediately. Okay, when as soon as your body is exposed to something you are allergic to, immediately you will see the response. Okay, you will see the change in your breathing pattern. You will start coughing, sneezing. Okay, hyperventilating, whatever. Sometimes swelling in some body parts. Okay, swollen eyes, swollen lips. If you have something, uh, ingested something that is allergic, you have an immediate stomach cramps. Okay, so allergic reaction is immediate. As soon as the food touches it, it need not reach your intestine, it touches your tongue, it gets into your esophagus, immediately you will see the response. That is allergy. Sensitivity, it may take time, the response is delayed. Once the food has to reach your intestine has to start working on it, then the body realizes, oh, this is the food that is problematic, then it will show the response. It may take a day or two. Okay, so what are the symptoms here when it comes to sensitivity? Bloating, gassiness, okay, joint pain, any irritable bowel syndrome, 2 to 3 days continuous diarrhea like motion. It may not be completely diarrhea, but diarrhea like motion. It's not solid stools that you are passing. Okay, tiredness, itching, low mood. Okay, your stomach is upset. You do not feel like having anything. Loss of appetite. Okay, weight gain because it may be some swelling. Okay, response, if the response is swelling, you will see weight gain. Okay, water retention, etc. It's not deadly. Nobody dies because of being lactose intolerant. Nobody dies because of any food allergy. Sorry, any food sensitivity. Okay, just because your body feels some difficulty to digest a specific kind of food, it doesn't make that food deadly to you. You will not die if you have that food. But the case is completely opposite when we talk about food allergy. Okay, there have been cases. See, in some movies you may have seen, some Hollywood movies you may have seen, a child who was allergic to peanuts or some specific kind of nuts or something. The child had that, and immediately the protagonist had to rush the child into the ER. Okay, get the child resuscitated. The child is admitted there. So if there was even a moment's delay, the child may have lost the life. Okay, like that. So allergic responses are very severe. Okay, just imagine your throat closing on its own, your trachea closing on its own because of the swelling. Okay, why trachea closes? It's because the bronchial layers and everything, they undergo swelling. Okay, inflammation, and there is only very tiny passage for the air to reach your lungs. Okay, that's how somebody can lose their life over a allergy, food allergy. Okay, even trace amount of food can trigger severe life threatening reaction. That's about allergy. So what are the food? Okay, we are generalizing here. What are the food? Okay, yeah, if you eat something and out of some time you will feel vomiting, nauseous, you feel bloated tummy. Okay, your distended stomach and all, that is sensitivity. Okay, it's not allergy. Because food sensitivity is usually about stomach cramps. Okay, your gut is feeling difficulty, great difficulty to break down the food. That's when you get this vomiting, undigested food wants to escape your intestines. Okay, that's how you get all this reaction. It's not allergy. Stomach pain, vomiting is not allergy, it's sensitivity. Okay, so most common sensitivity are gluten, wheat gluten, or only. It's not just wheat that has gluten, but there are various other barley, rye, etc. They have gluten. Milk, dairy, corn, eggs, sugar. Okay, you can have multiple food sensitivities. Okay, a single person, a single child, or a single person, somebody, a single individual, they can have more than 3 or 4 food sensitivities. Okay, they are lactose intolerant, they can't have meat, they can't have egg. Okay, they are sensitive to majority of the food. Okay, that can happen. Okay, but allergies, it's not like that. You are hardly allergic to more than 2 or 3 items. Okay, you may be allergic to just one item, 2 item, or it is very rare, where in very extremely rare cases an individual could be allergic to more than 2 food items. Okay, like usually peanuts, any nuts, okay, any nuts, eggs, milk, fish, like shellfish and all. Okay, seafood, not just fish. Some people are completely allergic to seafood in general. Okay, crabs, etc. Yeah, food sensitivity can take place at any point of your life. For example, growing up or during your early adulthood, you used to have all sort of dairy products, okay, milk, cheese, everything. But lately, when you started having pizza or even a single slice of pizza, even if you had a cup of chai with milk, okay, after a few time you feel distension in your stomach. Okay, you don't feel that good, your bowel movements are not good. But slowly, when on the days when you cut off dairy, you feel quite healthy, energetic and all. It means that you have started developing lactose intolerance. A person can go lactose intolerance at any point of their life. And also there have also been cases that during your early adulthood you became lactose intolerant, but by the time you reached your midlife or within few years, your body on its own overcame that intolerance. Okay, but when we talk about food allergies, it does not play out like that. So now coming to adverse reactions of food. Okay, one is either toxic or non-toxic. Toxic is, see, what, food poisoning. Okay, food poisoning or any toxins that have been manipulated into the food. Okay, for example, like recently, few decades back in 2015, etc. Okay, Maggie was banned in India. Okay, do you know the reason why Maggie was banned in India? Just for few months later, it came back into markets. Nestle Maggie was banned in India in 2015. What was the reason? Why did they ban Maggie? What was that toxic ingredient? It was lead. Okay, cyanide and all, it is not cyanide. Cyanide, even in trace amount, can just kill the person. Okay, it was lead. Okay, it was lead toxicity. Higher than ingestible amount of lead was found in certain Maggie packets. Okay, that's the reason why they banned it. So is it toxic or non-toxic? Finding such chemical substances in ingestible food, is it toxic or non-toxic? It is toxic. Okay, now you understand the difference. So what could be non-toxic? What could be non-toxic? Non-toxic means, for example, let's say gluten. Okay, wheat has gluten, maida has gluten, barley, rye, okay, they all have gluten. Is gluten toxic or non-toxic? It's non-toxic because gluten is an innate quality of the food. Okay, and sometimes these things that which are innate quality of the food, okay, of food, elements of the food that are innate quality, without which we can't call that food into a specific food category. Okay, for example, lactose is not a toxic substance, it's a non-toxic substance, but the way how certain individuals react to it is like it's a toxic substance. Okay, so adverse food reaction could be toxic because of its chemical structure, non-toxic because of its innate food quality. Okay, so even under non-toxic, okay, you may have a non-immune mediated response or and a immune mediated response. In immune mediated response, in this blue uh, column, here your immune system is involved. Okay, in non-immune mediated response, your immune system is not involved. For example, your stomach is not able to absorb a certain food, your gastric juices are not able to break down the specific lactose or specific food elements. Okay, those are non-immune mediated. Okay, antibodies do not interfere in the digestion. Okay, but in immune mediated, your antibodies, immunoglobulins, T cells, B cells, okay, antibodies, they interfere with your digestion. Okay, so that becomes immune mediated. In non-immune mediated, the basic enzymes that are produced in your body, they are not able to break down certain food categories. So non-immune mediated is all your food intolerance and food sensitivities. Okay, food sensitivities come under non-immune mediated because your immunity is not involved here. Okay, you are intolerant because your body does not have the capability of digesting it. Your immunity is not interfering at all. Okay, but when it comes to food allergy, that is immune mediated. There is an interference from your immunity targeting that particular food. Okay, this chart is on page number 465. Similar chart is given. Please check that. Preservatives, anything that is synthetic. Okay, when we talk about toxic, that are things that are not naturally present in that particular food when it is grown on the farm or when it is brought into the uh, manufacturing unit. Okay, something synthetically what we add. Okay, so whatever is synthetic, that could be toxic. Then foods that are involved in sensitivity, most of your animal sources, okay, like cow's milk, egg, some meat, some people are also allergic to red meat. Okay, poultry meat and all very rarely people get allergic towards, but red meat, yes. Eggs and cow's milk, not other milk, but cow's milk is the main culprit in many of the lactose intolerance cases. Okay, then plant sources, it's anything that has gluten for people who have IBS or celiac disease. Anything that has gluten is difficult. Okay, especially wheat gluten. And then we have peanuts or any nuts for that matter, cashew nut, peanuts, flax seeds, sunflower seeds, pumpkin seeds. People can be allergic to any of this. Then beverages, very rarely people do get sensitive to beverages. But if somebody who is allergic to barley or somebody who's allergic to yeast and all, they can't have fermented beverages like beer, whiskey. Okay, if somebody is wheat is used for making whiskey. Okay, if you are allergic to gluten in wheat and all, you can't have whiskey. Okay, yeast is used to ferment beer and all. If you are allergic to yeast and all, you can't have beer. Okay, so that's how beverages can be intolerant to certain people. Some people are allergic to fermented food like pickles. They can't tolerate pickled items, pickles, spicy pickle, or the plain salted one. They can't tolerate it. Okay, then food contaminants, that is your all toxic substances like preservatives, colors, fertilizers, insecticides, whatever is used. Okay, so these all things cannot be tolerated by certain people. Okay? So these are the different groups, food groups that can cause sensitivity. So symptoms, what are the common symptoms of food allergies and all? Skin manifestation, you may have dermatitis, itching. Okay, sometimes not just food sensitivity, even if you are sensitive to any cream or product which you have applied. Okay, small red eruptions at within few seconds will appear on your face. Okay, it is very itchy. Okay, there is no pus in that. Okay, you won't see pus formation. You just see red similar sized. Okay, so all the eruptions are of very similar size, color, and pattern. Okay, similar sized red bumps may emerge within few seconds throughout certain body parts. It becomes heated up. Okay, it is warm in temperature because of the inflammation. It's itching. Okay, you will feel the tendency to itch that area, so that these all becomes your skin manifestation. Okay, sometimes change in color, swelling. Okay, pruritus, edema, eczema, erythema is that redness. Okay, urticaria is the hives. Okay, the just now I explained how a person will get that continuous red bumps, similar sized red bumps. Okay, all over a certain part of their body, itching red bumps. Okay, so that is urticaria. We also call it as hives. These are all the skin manifestation. Then intestinal manifestation, you will have some blood loss through feces. Okay, fecal analysis has to be done. Inflammation in your gut lining. Okay, and children who are infants, when you wean them, into new food, you will see them crying, or they may have frequent complaints of gas. Okay, you have to, every week the parents have to take the child to hospital, and the pediatrician will say it is gas, it is gas. Okay, the child is having discomfort, distress in the stomach, that's the reason. So you have to do that introspection. Okay, whatever we are giving, whatever food we are introducing in the weaning diet, it may be causing the sensitivity in the child. So colic child means a child who's in distress, they cry a lot. Okay, especially at night and all, they cry a lot because of the discomfort in the child's stomach. Okay, then malabsorption, abdominal pain, cramping. Okay, all these are signs and symptoms of sensitivity. Then respiratory symptoms, it will take place only in case of allergy, not for sensitivity. Okay, in case of allergy, sneezing, continuous sneezing, bouts of sneezing, allergic rhinitis, that is like similar to sinusitis. Okay, continuous leakage of very thin liquid fluid from your nose. Okay, it's not mucousy, it's not slimy or sticky, but it is very watery leakage of fluid from your nose. Okay, that is rhinitis or similar to sinusitis. Then flatulence is farting throughout the day. Okay, dyspepsia is indigestion, you are not, the stomach is not able to digest the food. Nausea, vomiting, abdominal distension, even if you had a small amount of food, okay, very small amount of food, just a very small portion of food, but after having the food your stomach feels so distended, like you had a full plate of biryani. Okay, okay, but the amount of the food, it could be just one chapati what you have had. Okay, so a portion size was very similar to one chapati and a small amount of sabzi, but after having that, when you look down at your tummy, it is so distended, and it made you feel so discomfort. Okay, a small portion of food, if it can make you so discomfortable, it means that you are sensitive to what you had just had. Okay, you are intolerant to the food you just had. Then we have neurological symptoms like migraines, pain in your nerves, etc. There is neuralgia, tension, fatigue, irritability, anxiousness, okay, stress, eating, and all. These all are neurological symptoms. Then systemic symptoms, that is throughout your body. Anaphylaxis. Anaphylaxis is what we call as an allergic shock. It is life threatening. Okay, like first two bouts of anaphylaxis, you can save yourself by going to the emergency. But if it is a third time you are exposed to something allergic, it could be very life threatening. Even before you get your medicine, even before you get your shot of epinephrine, you may pass away. Okay, that is anaphylaxis. Anaphylaxis is the life threatening, like for example, if you have dust allergy. Okay, you are cleaning your house, you were exposed to some dust in some from some corners of your house, that is not anaphylaxis. Okay, you will have certain allergic reaction, but that situation may not turn as life threatening. Okay, if you just pop on a levocitrazine, okay, you have a antihistamine, take a rest for half an hour, you will be fine, but your allergy will resolve on its own. But anaphylaxis is not like that. It's a life threatening allergic reaction. Okay, the common symptom of anaphylaxis is that your throat closing up. Okay, your trachea closing up, your bronchi closing up because of swelling, and a very tiny small passage is left for air to come inside your lungs, and that too, it will not reach your lungs. The lungs will collapse and the person may die. Okay, so that is anaphylaxis. I didn't understand the cross question here, please elaborate that. Moving on to the diagnosis, how can we find out that is this an allergy or just an intolerance? So first is we have to take the dietary history. Okay, whatever the person had in the past few days. Okay, from the past 1 week, if they had something, we know, if we have the information, that is ideal, but it is very difficult to make the patient do retrospection to understand what they had from the past 1 week. It is difficult. So at least in the past 3 days or 2 days, whatever they had, if you get the history of it, Based on that history, you can then move forward. What could be the causative agent here? Then we have provocative test. A very small amount of, once you have dietary history, you know that in the past 3 days, these are the food items that the patient had at different points of time. Okay, in breakfast, lunch, dinner, doesn't matter. We should just get the list of items that the patient had. Okay, from there onwards, now we know what are items are there, what are recipes are there, what are ingredients have been used or put into the recipe. From that, we will take some suspicious ingredients and give that ingredient in a very small amount to the patient. Okay, we are provoking the patient's body to respond, to see, okay, this, to identify the culprit. Okay, so that is a provocative test. It should not be done on patients who can go into an anaphylactic shock. Okay, please remember that provocative test should not be done on patients on whom we can do who have a history of an anaphylactic shock. Neither do not do this provocative test on a pregnant woman or children. Okay. For cross means it is not seen. It is not seen. Okay, it's not this particular symptom is not seen in presence of that particular immunoglobulin. Then we have the elimination diet. So with every day, it may take some time, it may take few days also. So with passing of every day, a suspected food will be eliminated. Okay, but if you can't do the provocative test, for example, if it's a small child, it's somebody who had a anaphylactic shock in the past, we have to still find out the culprit, right? So we can do elimination diet. Okay, since we can't do provocative test, we can do elimination diet. Day after day, a suspected food item should be removed from their diet and see how the body responds. Okay, so the day when the causative agent is removed and the patient's health improves, we can identify that this was the cause of intolerance. Okay, so that is elimination diet. Then laboratory testing, it is much more specific. So skin test can be done. In skin test, there is a nowadays we have this dermal injections. Okay, a 40 injection set is injected into the dermal area. Okay, a subdermal injection is given, and after 24 to 48 hours, the patient is called back to see which all patches is giving the reaction. Okay, so based on that, we can identify what is the exact allergens, not just the food allergens, but also apart from food, what all other external allergies the patient has, we can find that out. So skin test is that. And then we have radio allergosorbent test. So in that, again, some barium sulfate etc is given, and we identify how your immunoglobulin reacts to specific food allergy, because the immunity will react only when a specific food item enters your body. Okay, otherwise your immunity will not react. And which immunity? Your immunoglobulin E, how it responds, how it binds with the allergen, that's what we are focusing here. Okay, so that is radio allergen test. Then we have X-ray. Barium sulfate is given to the patient to ingest. It comes in different flavors also. Sometimes it is flavorless, sometimes it is flavored. Okay, a small amount of barium sulfate in liquid form, the patient will swallow that, and immediately we take the patient for an X-ray. And in the X-ray, we can see the entire GI tract. Okay, as a fluorescent image, we can see that because barium can undergo reflection even when X-ray rays will hit on it. Okay, so we can see the entire lining of the GI tract from the mouth up till the intestine. And with the help of this image, we can identify which area of the patient is currently undergoing spasm. Okay, spasm, contraction, or swelling. based on the way how the linings are represented. Okay, so then we can identify, okay, there is a spasm going on, means the patient is intolerant to the food that he recently had. Okay, then we have basophil histamine release test. Like even if you do a simple complete blood count, okay, you go to a laboratory, do a complete CBC test, complete blood count, your the amount of basophils histamines in present in your serum, it will be analyzed. Okay, if the amount is more than the reference range, it means you are allergic, you recently had an allergic reaction to something. Okay, so basophil and histamines are there in your body just to combat allergens. So food sensitivity, which is found in children, usually cow's milk is the most common allergen in infants. And even if they are allergic to egg or fish, when the child grows up into adolescence, teenager, adult, they can eventually overcome this intolerance. If it is allergy, they will not, but if it is intolerance, they can overcome it. Next, coming to treatment. So first is the elimination diet. In elimination, we have simple exclusion as well as multi-exclusion. Okay. In simple exclusion, only a single food group will be removed. For example, let's say milk. Okay, milk, all milk products will be removed from the diet. That is single exclusion. Okay. Multi-exclusion, when we are not sure about if it is not milk or if it is not a commonly known ingredient that is causing this sensitivity or allergy, we have to do multi exclusion. Okay, so it's a trial and error kind of thing. Okay, you exclude various different things from the diet of the patient. It may take weeks also, it may take weeks also to identify the culprit here. Okay, so basically it's a trial and error method. So initially you will just exclude a wide range of food, which you know that for the general population, this wide range of food has always been seen as a culprit. You will remove all those food, and slowly the number of food that is removed from the diet, and still you do not find a good response from the patient, again slowly your whatever diet is left for the patient, that also you will try to decrease. Okay, so that is the multi exclusion. First you will remove all the generally known allergens or intolerant substances. If you do not find your answers there, then you will go to next step. Whatever is left for the patient to eat, you will start removing that as well. Okay, so steps for multi-exclusion, if you go to page number 470, there is a figure 21.2. Okay, very nicely they have explained in 4 steps how you can do multi-exclusion. Initially, you will just exclude milk, dairy products, eggs, etc., which are commonly known allergen, non-intolerant substances. Okay, then in the second step, you will remove chicken, turkey, fish, shellfish, any fruits, nuts, peas, etc., like groundnut, peanut, etc. Okay, then you will go for yeah, then even if you do not find any positive response from the patient, then you will remove all the fruits, vegetables, except for some carrots, celery. Okay, something that is quite nutritious, which do not have a history of allergy in the human population. Except for that, all the other vegetables will be eliminated. So and finally, if after eliminating all these kind of food, even after putting patient on a parenteral nutrition for a few days, you have found no allergen so far, you can conclude that the patient does not have a food allergy, does not have any food intolerance. No, it is refrained. It is ideal to refrain all the food because it can give mixed reaction. Okay, because sometimes what happens is that a specific food will not cause sensitivity. A specific food, when combined with another food group, that may cause some sensitivity or allergy. Okay, that could also be a reason. So to avoid that, you when you start eliminating the food, you will not reintroduce the previously eliminated food. Okay, because sometimes some combinations may cause allergy rather than single food groups. Then we have hypersensitive sensation. So small doses, again the same way, small doses of food will be introduced to the patient's diet. And when you see the patient is responding well, initially the patient was intolerant, but now the patient is not showing any intolerant symptoms, means the patient have overcome the sensitivity. Okay, so that is hypersensitization. Then we have drugs. The commonly used ones are your antihistamines, and in some cases, corticosteroids, bronchodilator drugs are given only if the patient has respiratory allergic symptom. Only then bronchodilators are given, and corticosteroids and antihistamines are prescribed to overcome the allergic responses. So drugs you can't prescribe. Okay, as a nutritionist or a dietitian, you can't prescribe drugs. Only a general physician can do that. Then for dietary advice, the best thing is to avoid, give the advice for the allergic patient to avoid that food. Give them the list of the food that may have a specific allergen as a ingredient. Okay, and ask them to avoid it. So now you can come back to the basic differences between food tolerance and food allergy. So symptoms of food intolerance, it includes bloating, diarrhea, nausea, indigestion, eczema, asthma. Okay, asthma is very rare in intolerance. Usually it is seen in food allergy cases. In food allergy, swelling, vomiting, hives or urticaria. Urticaria is the medical terminology we use. In common layman's language, we call it as hives, that red bumps over the skin. Okay, it's a dermatitis kind of scenario. Then intolerance occurs when you are unable to properly break down the food. Okay, your immunity is not the culprit here. Your innate ability, your innate gastrointestinal system's innate ability to break down certain food is not adequate. So that gives you intolerance. Okay, then in allergy, your immune system is involved. Okay, it's intolerance is non life threatening. Food allergies, they are life threatening. So similarities between these two, there is no specific cure. Okay, but there is a chance that intolerance can like resolve itself over a period of time as a child grows older. Okay, there is no that why the body is not making a particular enzyme required for digestion, we do not know. It could be an inborn error of metabolism as well. Okay, when we will discuss that chapter, inborn errors of metabolism, it will come up again. Repeated sessions will come up again. You will understand various different types of inborn metabolism, errors of metabolism, and its effects. Okay, basically we have also seen this pattern that the foods which are commonly known to cause intolerance, okay, initially, and later it converted itself into allergies. Okay, such cases have also happened in the past. Okay, initially it was just an intolerance, but later it became allergy. Okay, like eggs, shellfish, nuts, dairy, wheat, etc., gluten, fish, any soy products. It's not the yeah, intolerance and sensitivity are the same. Okay, you can use the word intolerance and sensitivity interchangeably. Then FODMAP, please understand the abbreviation for this. Questions can come from this FODMAP. Okay, FODMAP stands for fermentable oligosaccharides, disaccharides, monosaccharides, and polyols. Okay, so people who have food intolerance, okay, they should try to avoid food that have these kind of carbohydrates. Okay, all these things which you see on the slide right now, these are carbohydrates basically. So the foods that are rich in oligosaccharides, disaccharides, monosaccharides, and polyols, avoid that. Okay, some citrus fruits, polyols are present in all your artificial sweeteners, and some citrus fruits like blueberries, strawberries. Okay, avoid that. Monosaccharides in highly sweetened fruits like mangoes, Alfonso mangoes, etc., bananas, and some specific kind of yogurts, or specific kind of flavored yogurts. Disaccharides are there in your all dairy products, okay, which has lactose or lactic acid. All dairy products have disaccharides. Then oligosaccharides are there in your bread, pasta, pizza, okay, baked items. So avoid these kind of food. It will be very easy on your stomach. So low FODMAP diet, these are the fruits and vegetables and other cereals and pulses what you can have. You can take a screenshot of this as well, or you can refer the YouTube channel as well later.